Good evening, CAN TV viewers. Thank you for tuning in to the Doty Report on Comprehensive Health. My name is Yolanda Gibbons, and I am the host for this evening. As you know, we are here every Tuesday at 7:30. We are talking about health and health care and health resources and the health disparities within our communities. And we are always excited about having guests who is able to provide us with some education and some knowledge and even some resources. I always like to give a shout out to the president and CEO of Georgia Doty Comprehensive Health, Mr. Don Doty, and his wife, Miss Joyce. Hey, the Dotys. And we're going to get right into it because we have several guests, and I'm excited. The information that they are about to share with us is very, very, very important. We're going to be talking about home health care. And if any of you seniors out there, sons and daughters of seniors, parents who are needing some health care within a home, you understand how important it is to find some quality home health care service. So I'm going to get right to it. As you know, we encourage you to call in with questions and even comments. So we're going to get right into it. I'm going to introduce my guests, and we're going to get into a conversation. So I have with me Mr. Dan Franklin.
Hey, how you doing?
He is the president of Essential Home Healthcare.
Yes,
that's correct?
That's it.
And next to him is Pat Waltman.
Yes,
she is the director of nursing, and we're going to have another person to join us in a few minutes or so. So we're going to get right into talking about essential home health and healthcare and just how important it is.
Well, it's very, very important. First of all, I want to say thanks so much, Yolanda, for having us on your show today. It's a pleasure being here this evening. I just want to talk about one of the main purposes of why I started this company, why we started Essential Home Healthcare. What I've noticed is that, for a lot of seniors, especially within the African American community and just abroad, the ethnic community periods, that there's a great disparity of healthcare that goes along, that goes out to these communities and things like that. They're not receiving top-notch care. They're not receiving, a lot of hospitals in these areas are being closed down. So, I wanted to think of a way to try to give back and to give people like that 10-star type of healthcare experience.
Absolutely.
It's a lot of companies that's coming inside of our neighborhoods, and they're like, saying, hey, look, we'll do one thing, but in essence, you know what I mean, the patients or the people are just, they're losing. They might end up having great benefits, and then at some point they might change them over to an HMO. And I know a lot of you guys out there have probably heard of that horrible word, HMO, and you're stuck into just a certain bracket of doctors and hospitals and things like that, and you're not able to to explore. We were saying that, hey, look, a person that has a Medicare card, that's that red, white, and blue card. A Medicare card, that's like having a platinum, credit card, and it's like having like the top-notch credit card that you can possibly have in healthcare, and you can go to some of the top hospitals in the state of Illinois or across this great diaspora. And a lot of people just don't know that, Yolanda. So it's just such a it's such just a bad thing that happens, and so you worked all these years, and then to get to this point to where, hey, look, I'm 65 years old now, and now I can't even get adequate health care. So we wanted to come in and say, hey, look, we want to put a stop to that, a halt to that, and bring a company that's reputable hire on the best nurses, from some of the top hospitals, hire on some of the top physical therapists from the best hospitals and around it, hire on some of the best, occupational therapists, speech therapists, everything. We wanted to bring those people in our staff, to bring just another wave of breath of fresh air, to not just to our community, to the African American community, but also throughout, the whole state of Illinois. We're covering right now 13 different counties. Our largest counties that we cover is Cook County, and in Chicago has a lot of our patients right now. It's amazing, and just to see the lives that's been changed, through our company, has been amazing. Just last week on Sunday, I got a text mail, email from a patient who literally gave up on life. Literally, yes. She literally gave up on life. Said, "Hey, look, I just want to die." She went to the hospital and they said, "Hey." She said she refused all care. They wanted to do exploratory surgery on it because they didn't know what was going on. And I try to take another step. I actually go to the hospitals where my patients are.
I love it.
Because I want to give them just that special touch, you know what I mean? Because I have, I got family members that's a part of my agency, and I believe that, hey, look, I won't give you anything that I won't give to my family, you know what I mean?
Right.
So, so what happened was that, one of our patients or whatnot, she gave up on life, 2 days after, they gave only 24 hours to live, right? She came, we met with her at the hospital. She told me, I don't want anything else. We actually went to her house to do the discharge and just let her just live out the rest of her days. This was a month and a half ago. She emailed me, and said to me just this Saturday and said, "Hey, Dan, I just want to thank you so much for what your home healthcare agency did, for me. I'm living. I can live again." She emailed me again today and said, "This is my first time in 5 years that I was able to step outside of my home and walk outside." These are the type of things that we're doing for the people that's in our home healthcare agency. We're not just doing this just to have a number or anything like that. We actually want to see people progress. You actually want to see people get to the next level, you know what I mean? And live an adequate and productive life.
Right.
And I can go on and on. I'm sorry.
So this is essential home health care. We're talking about the services of having quality services, home health care in your home. I can personally understand because I know my mom, who had been healthy all my life, suddenly had this massive stroke, and I'm scrambling, between me and her, trying to figure out, from the hospital to the rehab to home, trying to help her recover. And I first of all, taking the time to try to understand this and not really having the source. Right. So you're providing a resource to even help someone like me in that time.
And it's 100% free.
And it's 100% free.
It's 100% free. They don't have to pay one dime out of pocket.
Wow.
It's already covered underneath Medicare. They don't have to pay one dime. And we're doing this for free. We're going into people's homes and saving lives.
I need you to go to Memphis.
We'll be there soon. We'll be there.
But I know, and we're going to get into the actual care. I know for a fact, if I had not gone back and forth to Memphis and I'm not a healthcare practitioner in no way, but I know I saw what she was getting. I know if I had not been there to help her to try to talk and walk, and she would not have recovered as progressed as much as she have. She hasn't nearly progressed as how I wish, but of course she's my mom. But I did a lot. You know what I mean? I'm like, I'm not doing enough. They was doing to me the bare minimum. So it's important. I wish I could have got quality care or just knew, but time was of essence. You know what I'm saying? So even trying to research and find, I just had to be there. So it's important, viewers. This is a very, very important topic because we know with our seniors, with things happen. You know, for me, my mom, healthy, had a stroke. Who knew she would need care in the home and would need like occupational therapy and a nurse and all of those things. So this is a very, very important topic. I hope you're tuning in. Don't forget, call in if you have any questions. We got some experts sitting here, so we're gonna jump over to the director of nursing and just talk about Miss Pat and talk about the quality of care and what's going on in the home.
Well, the purpose of home health is to teach people how to take care of themselves.
Okay.
We want to teach
Absolutely.
them about the disease process, how to manage their disease,
Love that.
medication management, nutrition, exercise.
Oh my God.
All of
Yes.
those things are very important in our seniors.
Yeah.
Very important. And they really don't know
No.
how to take care of themselves.
Right.
And our goal is to teach them how to take care of themselves so we can keep them out of the hospital.
Right.
That's the
Absolutely.
always
main
our goal.
purpose. Yeah.
That's always our goal. And our nurses, we spend time with our patients. We teach them about the disease process.
Okay.
For example, a lot of our patients are diabetics. We have a lot of diabetes in the African American community. Diabetes, hypertension, they seem to go hand in hand. So it's very important to teach them how to take care of themselves, how to take their medications, why they're taking certain medications. Because sometimes you go in, you ask patients about their medications, they don't have a clue.
Right.
They'll tell you, well, that's what my doctor said I have to take.
Right. Right.
So they don't know, they don't understand.
Right.
And then diet is very important, especially with the hypertension. You want to stay away from salt. With the diabetes, the sugars and the carbs, you want to stay away from those to keep your blood sugars within normal limits. Very important. And people just don't know. And I like to use the term that people don't know that they don't know that they don't know.
Absolutely. Absolutely.
And so the goal of nursing is to go in there and teach people.
Wow.
And, if we can talk about the African American community, lots of them don't even know that this exists.
Right.
Yeah.
Right.
They don't know that it exists. We can provide physicians will come to the home, which is wonderful.
You need to know about this
Yeah.
stuff.
This means a doctor
Absolutely.
can actually come
Doctors
and visit your
are
house.
making house calls,
House
and they're coming
calls.
to these patients. You're not having to struggle to leave the home and go to the doctor's office, and then you're having to wait to be seen. And then when you see him, he's only there. You only talk to him about 15 minutes,
Right.
and he's out
Right.
because he's got another patient in another room.
Right.
Not
So
only-
we have a caller. Let's hold on. Let's get this caller. Caller, are you there?
Yes,
You have a question?
yes, I have two questions.
Okay.
Do you provide home health for individuals with HIV?
Yes, we do. We can provide home
can.
health care for patients with HIV.
Yes, we do.
With any disease process.
They provide home health care, whomever is in need of it. Right? Right?
Yes.
Okay.
Any disease process.
You have another question?
Yeah, and because you're a minister, do you provide spiritual advice and spirituality to your patients?
We can provide that as well. You know, I'm always one who is willing to talk to someone about enlightening themselves about a higher power, if we could say that.
Right. Thank you, caller. Appreciate it. So I was gonna ask a question like, who's going in the home? Is it nursing aides, CNA? You talking about
Actually,
doctors?
We have physicians, we have nurses, we have physical therapists, occupational
RNs.
therapists. Our nurses are RNs.
And
Okay.
LPNs as well.
Okay.
Yeah. And we provide medical social
Just going
workers.
to say that, yeah.
We provide podiatrists
Okay.
because, because many of our patients have type 2 diabetes, I always send a podiatrist to.
Okay.
You don't have to lose your feet. if you take care of your feet.
Wow.
Right.
And I always send a podiatrist into the home.
I mean, and they can even get like diabetic shoes. We can set them up for hospital beds in the home. We can get the canes,
We can get 'em walkers, canes,
everything, and it's all
And it's all-
100% free.
All covered by
I'm
Medicare.
just loving this. Like, we
Yeah.
need everybody to know
Yeah.
about these services. So, someone calls you and say, I need care. What happens?
So from that point, when someone calls, well, I don't know, Pat, you want to take this one away with me?
Well, if the patient calls themselves, or sometimes it might be a family member, son or daughter that might call, we can give their information to our home physician. Our home physician will come out to the patient and do a complete assessment.
Okay.
Okay? And then once he does his assessment, he sends the orders to the agency.
Okay.
For nursing, for therapy, whatever
Whatever the
he
needs
thinks the
are.
services are
I
that they
love
need.
it.
And then once I get that, then I will assign a nurse to that patient.
Okay.
Okay? And also, too, what we do is we call the patient, we welcome them to Essential. We let them know that their doctor has referred them to us.
That is the other thing, because even with the people coming to the home, you want the patient to be comfortable.
Exactly.
Oh, yeah.
And
We-
feel.
Exactly.
Sometimes, I think seniors, they don't get care because they're afraid.
Yeah, I stress that from the beginning. I mean, I think we have meetings about that every week about, you know, hey, from start to finish, I want these seniors to know that, you know, we're excited about coming into your home. You know, we want you to, you're part of a family now. You know, sometimes they don't even have their own family members who's caring for them or anything. They're alone. You know, so like, you know, we have one patient that just looks forward to the nurse coming on
in.
every
Yeah.
single week. She's
Yeah.
cooking, you know,
Yeah.
Italian bread and making coffee and
Yeah.
everything like
Yeah.
that.
Yes.
You
Yeah.
know, so it's just an amazing thing. You know, and today we actually brought a guest with us.
Yeah, we're gonna bring Miss Diane up. This is the Doty report on comprehensive health, and we are talking about home health care. We have the president of Essential Home Health Care. We have the director of nursing, and we have someone who could talk about from the other side of it, the services that are being provided, and just the importance of home health care and being able to find quality care. Like, I'm so excited. Like, I want everybody to know that this service does exist, and there are people out there providing home care, because there's so many myths and horror stories that you hear about it. So we are welcoming Miss Diane.
Hi, hello.
Thank you so much for joining us.
Thank you for having me.
I understand that your mom,
My mom
your
is
mom
receiving
is
home
receiving
health
care. So
service.
can you talk about your experience?
Okay. Hi, my name is Diane, and my mom, she's a client of Essential Home Health Care, and she's receiving services with this company. Man, this company is a great, great, great company. It's very beneficial, and it's very accommodating. As my mom, she's elderly. It's kind of hard. They get older, they slow down, and it's kind of hard for them to go to their doctor's appointment, like the long wait lines, or registration may be long for her, standing up may be too long for her. So
Right.
what's accommodating for her is Essential Home Health Care. They will have their skilled nurses come out, and they're good at scheduling appointments and just make time to accommodate her.
Okay.
Yeah.
Yeah. Actually, I know that when we were talking about with Diane's mom, is that one thing was that she had an issue with stamina and shortness of breath.
Okay.
And it was a big thing with her. We started giving her physical therapy, and within about the 3 weeks into it, she was able to to actually her stamina increased by by a great deal.
Okay.
So much so that she even made the physical therapist oh my God, I couldn't believe she was progressing so fast.
Right.
So that's just something that we do. I mean, we just want to come in and just really just come in and just be effective.
Right.
It's about having effective care. not just for the African American community, but for every place that we touch.
Absolutely.
I mean, the main reason why we talk about, the African American community so much is mainly because they just don't know.
They don't.
There's something that says that we perish for a lack of knowledge.
Absolutely.
You know what I mean?
Absolutely.
So, and literally,
Yeah.
right?
No, we do.
So, we want to come in and just do that for people. We're in 13 counties. You know what I mean? We're in Cook County, we're in DeKalb, we're in Kendall, Will County, Kankakee. I mean, wherever you are, we can literally bring somebody there. Diane, I mean, like, what's some of the things that you've noticed different about your mom?
Well, what I noticed is different about my mom is receiving care. What she really likes about it, they have a staff of nurses, skilled nurses come in, and they come to her appointment, one-on-one care in the comfort of her own home, and that's very good and secure for her.
Right.
As far as being elderly, they kind of like worry about security reasons and things like that. So they would come out, the nurses and the doctor, and provide one-on-one assessments and treatment for her.
Right.
So that's
Right,
very
right,
good
right.
on her end.
Right, that one-on-one care. This is like so very, very important. Home health care, as you get older, seniors, or whether you're dealing with things like diabetes, in my case, like my mom, with the stroke, being able to feel comfortable, having someone come into the home, being able to access this resource.
Yeah.
And can I mention this one thing? You don't have to just use our physicians either. I want to just talk about two things.
Okay.
One thing is that your doctor can actually fax over or email. We have a thing where they called suture sign, where they can actually send us over the physician's orders from their PCP or primary care physicians. So their primary care
That's good to know.
physician can
That's
send
good to
that
know.
information over to our clinicians and to our DON. She'll then assess that, look over it, talk with her, or talk with the patient's primary care physician. From that point, then we'll set up a scheduled plan of care for that patient. The next thing is that even if that patient was in the hospital and they're about to be discharged from the hospital, patients have the right to choose. I want to say that. Patients have the right to choose. You do not have to take the home health care agency that hospital gives you.
Okay.
You do not have to take it. So whatever, if they tell you, hey, look, this is the home health care agency we sending you home with, you do not have to take that agency. You can choose any agency you want.
Absolutely.
And I hope you choose
That's true.
Essential Home Health Care. But the next thing is that if they do choose to use our mobile doctor, our visiting physician, it does not affect who their primary care physician is.
Okay.
We still correspond with their primary care physician and send them progress notes on what's going on with their patient, as well as talking to that visiting physician. And it does not affect any co-pay money. The insurance doesn't go up. You don't have to pay any extra dollars or anything like that. It's all free.
Free. I want to stress.
That was under Medicare.
Free quality care
Well, I give them the phone
in
number.
your home. I want to stress, and I can attest to that you do have the right to choose. I was talking about my mom. I went there. Then I came back home and went back, and they had put her in a rehab. I walked in the rehab. I was like, oh no, not this rehab. She won't be. It was like how they say 2.5 seconds. They was like, I ain't never seen nobody move a patient so quick. Oh, she won't be up in here. So it is important for a couple of things I heard. That it's important that we understand that they have the right to make a decision. And if you are fortunate enough to have a great primary care physician, you don't have to change.
Yeah, you don't.
That's very important too, because we do have seniors who've had the doctor forever and ever. They really love the doctor. They feel comfortable. That's very important.
And oftentimes it's an alternative measure also. Sometimes mom doesn't want to go into a senior building, or she doesn't want to go into a nursing home or something like that. Like, this is an alternative, so you don't have to put your mom in those positions, or dad in those positions. I know I'm talking about mom.
I know.
But,
It's all about our moms.
Mom or dad, we haven't forgotten about you, Dad.
We haven't.
But,
We haven't.
you know, regardless of whoever it is. I mean, and then another thing is, I know our time is running short, but I got patients also who are under the age of 65 as well.
Mm-hmm.
They might have just been deemed disabled, and now they have Medicare.
That's good to know.
So,
That's
you
good to
know,
know.
I'm just, I'm happy about this, and I hope that this word can get out there and we can spread it out there and we can get people in and let them know.
So I know we about to wrap up. Let me just say again, we're talking about home health care. We have Essential Home Health Care Agency here that's talking about quality free services that they are providing for seniors and those that have been diagnosed as being disabled for whatever reason. Services from occupational therapy to physical therapy to just that day-to-day type of care. So this is definitely a good resource. So I want to say this, and we talked about it before we got on air, the open enrollment. What can you say about open enrollment and the importance of health care?
Okay, so open enrollment right now has been from, I believe, October 15th until December 7th. Okay. So October 15th through December 7th. That means that if you have an HMO, you make your HMO secondary to pick up that 20%, and you make Medicare primary to cover the 80%. Okay. Or you can just go straight Medicare, okay? But whatever you do, do not have an HMO as your primary, because you are limited to what type of care you can receive, what type of doctors, what type of hospitals, everything. You're going to cut yourself off, and you're going to do yourself a disservice for all the years that you've been working. Please.
Wow. Very, very, very important information. This is the Doty Report on Comprehensive Health. You know that we will be back here next Tuesday at 7:30. I want to thank Mr. Franklin and Miss Diane and Miss Pat. Man, we could do this for a whole 30 minutes. If you want more information about Essential Home Health Care, go to Georgia Doty website, or I've been giving my Facebook page, facebook.com/Yolanda Givens. Essential Home Health Care has a Facebook page.
Yes, Essential Home Health Care Inc. Healthcare is one word. Go find us, go follow us, go like us. You can find us on Facebook, Instagram, Essential HHC on Instagram, and you'll find us.
Georgia Doty, I always get the darn website mixed up. GeorgiaDotyInc.org. All of the information will be there. We thank you. We thank you so much. This is just so important. And don't forget to save the date of November 28th. The organization is having a health forum on breast and prostate cancer. I believe you guys gonna be there.
Oh, you better believe I'm gonna be in the house.
So November 28th. They will be there. Don't miss it. Again, we thank you for tuning in, and I will see you next Tuesday, same time, same place. We thank you for tuning in, and have a great evening.
All right.